My name is Max Watson. I'm a professor of palliative care working in Northern Ireland and in London with Hospice UK. Over the past 30 years, I've travelled teaching palliative care to many different countries. Since 1990, I've been involved in Nepal and seen firsthand for myself the need of patients for palliative care services. I've also seen the development of Hospice Nepal, on behalf of whom I'm making this appeal and this film. In the film, you will see what pioneering work Hospice Nepal has already achieved in its 20 years. But now an opportunity has arisen to purchase land and to build a national palliative care teaching centre, which will also be a facility for adults and children. Thank you for taking the time to watch this film and to learn what partnership with some truly amazing people could achieve. Hospice Nepal is a registered, non-profit, non-governmental organisation established in the year 2000. It grew out of the vision of four friends who recognised the need for effective palliative care services in Nepal.
When we first started palliative care, we started out in a private hospital where we rented the beds from them and provided free service for the patients. So we started out with 4 beds, and soon we had to make it to 6 beds. And then we decided that we had to come out of the hospital environment, and we leased this land here and built this building and started the 8-bedded hospice after that.
It's a long history. It's almost 17 years back. 4 of us, we are the friends from our schoolhood. Yeah. So we are thinking that we should give something to the society which others have not started. So this is the main reason that we have come up with this service, because at that time nobody knows about the palliative care services. There are many patients who are suffering from cancers and they are traveling to India for the treatment, but they are coming back with empty hands. No? So because of that reason, I'm very proud to be one of the partners for this noble cause.
My name's Max Watson. I am a professor in palliative care and I've been working in Nepal since 1990. Initially as a GP and more recently as a specialist in palliative care. I've been working with Hospice Nepal since 2004 when we ran the first Essentials in Palliative Care certificate program in Kathmandu with Dr. Rajesh Gongal. And since that time, we've really watched how Hospice Nepal has been developing as an organisation with its teaching and with its care of patients. Dr. Rajesh came to join us in Northern Ireland in 2014 for an 18-month fellowship to get his own specialism in palliative care. And he's now back in Nepal, very much part of the future development of Hospice Nepal, which we hope will have real impact on the whole country.
Basically, the ethos of hospice is to reach out to all parts of the community, poor or rich. And for this reason, we have been providing free service to most of our patients. To others, we provide, ask for a nominal charge. But for any patients, even if they cannot afford, we provide the service.
When we started the hospice palliative care, when we went to get a permission for hospice, I went to Minister of Health and walked into a supposedly person who's supposed to give the consent. I went and told him, see, we are doing this for cancer patients. He said, what is hospice? I said, this is what we're doing. Without even thinking, he just signed it because he said, it's not doing bad, it's for cancer patients. So, but when I later went on phone, I asked them, nobody knew what hospice was. So one of the things, practically what we started when we started was, we started giving awareness to people that palliative care is here. There was times when we had to pay the patient families. I had to pay for the cabs, 200 rupees. I tell them, go to hospice, see the place. Now the people themselves say, okay, I want to go to hospice.
Palliative care is not widely available in Nepal. There are a few independent hospices for people who can afford them and a few hospitals providing basic palliative care in their oncology departments. But this provision is sparse. Hospice Nepal's vision is to expand its own services and become a centre of excellence in palliative care training for the government and for other health service providers right across the country. To achieve their vision, Hospice Nepal need to buy their own land and build a modern 20-bed hospice, complete with state-of-the-art training facilities. This will allow them to provide an exemplary service and implement an unfolding program of palliative care training for health professionals and communities across the country. Sustaining their vision into the long term is essential. Hospice Nepal have a business model to meet their ongoing operational yearly costs by generating income from quality training through agreements with the Nepal government provided to health professionals and communities from across the country. Donations, legacies and fundraising events from within Nepal. Contributions collected from those patients and from families who are able to pay towards care.
We believe there's nothing more important than providing that care for patients at the end of life. And that end of the journey in life needs to be comfortable, dignified, and we think that's the right of every person, whether rich or poor, to have that care. We all have to die, and we all have to go through that journey. And we want to be there for the people when going through that journey.
Please partner with Hospice Nepal to make their vision a reality.